Dr. Evita Singh. I'm a diagnostic radiologist at Envision Diagnostic Center. Mammogram is basically our best way to detect breast cancer that we have available right now. It's a picture of the breast taken in 2 dimensions. Without mammograms, we really have no way of detecting breast cancer as early as possible. 3D mammography or tomosynthesis is the newest technology that we have available for detecting breast cancer. Previously, we used 2D mammograms, which basically were just 2 pictures of the breast. A 3D mammogram takes multiple images of the breast, similar to how we had black and white TV and now we have LED TVs. 3D tomosynthesis has really improved our ability to detect cancers when they're very small, as well as reduce the number of patients that we have to bring back unnecessarily for either imaging issues or what we call false positive, benign things that are not cancer. The American College of Radiology and our organizations recommend that every woman should get a mammogram starting at the age of 40, followed every year. Unfortunately, every woman is at risk of breast cancer. As we get older, our risk increases. People who have a slightly increased risk to the general population would be those patients who have family history of breast cancer, women who have been exposed to different levels of radiation if they've had prior cancers before, and as well as anybody who's had family members with ovarian cancer or uterine cancer. We do notify all of our patients what their breast density is in the letter that they receive with their results. The 3D mammogram has been great in addressing the patients that have denser breasts. Dense breasts can hide cancers, so they can grow to a larger size before we can detect them, but the 3D technology has really made it much more easy to find those abnormalities. This breast center is one of the unique options that we have in this area. We have a radiologist on site when every mammogram is done and any diagnostic workup is done. So if you're there for a diagnostic examination, all your additional pictures, including an ultrasound, would be done on site, and you would receive results and recommendations at the time of your visit. There is a breast surgeon who's also working with us who can then follow up with the patient accordingly. We can do biopsies on site and make sure that the loop is closed. The most important thing that we know about breast cancer is that early detection really saves lives. If we find a cancer when it's very small, typically before you would ever notice it on a physical exam, the chances that you survive is nearly 100%. If we wait for cancers to be clinically palpable, the chances that it spread to lymph nodes or further into the body is dramatically increased, which then lead to early death and mortality.